SynchNeuro. Thanks to the AHA and MedTech Innovator program for inviting us to speak here today. Your brain is the command center for your body. It controls everything from your blood pressure and your heart rate to your behavior and your emotional reactions. With so many tasks to do, it is no wonder that the brain is the largest user of glucose in your body. And it has a lot to lose if that glucose gets out of balance. Therefore, it acts as a thermometer for glucose in your body, constantly adjusting for your body's needs. My co-founder is a neurosurgeon who spent a decade at Stanford University with his team discovering how to tap into this unique intelligence, which is behind our product. 1 in 3 Americans are living with prediabetes or type 2 non-insulin treated diabetes. And if they do not modify their lifestyle, they will progress on to needing insulin and the devastating complications of type 2 diabetes. We have talked to many hundreds of patients in this population, and they have a similar care journey. They say, I go to my primary care provider once a year, I have a blood test, and my A1C creeps up just a little bit every year, and so does my anxiety about that. But they're given the kind of general medical advice we all love to hear at the doctor, like lose some weight, exercise more, eat better. And they leave those visits wanting more. They want more guidance, and they want more tools to get healthier. Unfortunately, health insurance companies do not cover the tools these patients need. We have developed a brain signal-based, non-invasive glucose monitor. As you can see in this image, there's a small sensor that is non-invasively worn behind the ear. I'm wearing one too, if you want to see it after. And it continually monitors the electrical signal changes from the brain that fluctuate when glucose fluctuates. And then using machine learning, we're able to translate this into something a user could understand about their real-time glucose levels. And because the brain has predictive capabilities, we're also able to use unique features of the brain signal or EEG signal during sleep to predict how sensitive a user will be to glucose on any given day. So similar to how you probably looked at a weather forecast this morning to determine what kind of jacket to wear, our patients will get a glucose forecast with actionable guidance for how best to live their day. And this is what they want. They're tired of being reactive to numbers and information. They want to be more proactive with their health. And because metabolic health is about more than just glucose, how you sleep, how stressed out you are, how active you are, all come into play. We have also found ways to measure these from behind the ear from the same sensor and give metrics and guidance related to those. This will help give us a holistic view of metabolism. We've done a lot of proof of concept work over the past 4 years since we were founded. One study involved 16 patients that came in the hospital, and they were in the hospital for 2 to 9 days. We had a glucose monitor on them, as well as electrodes placed all over the scalp, but behind the ear where we intended our sensor to go. And in this image, you're looking at one patient and 1 day of time. The CGM, or continuous glucose monitor tracing, is in blue, and the arrows mark their regular breakfast, lunch, and dinner times. And as you can see, our EEG, or brain signal-derived glucose, matches quite nicely. And importantly, the error across all 16 patients was 11.7%, which is already within the range of FDA clearance accuracy. We know with our future study, we can only train our algorithm to be more accurate. So how is it different from the traditional continuous glucose monitors out there? We can provide this glucose forecast that I mentioned and proactive guidance related to it. It's completely non-invasive. There are no needles. It's comfortable to wear, and it's rechargeable. It's an all-in-one wearable, so in addition to glucose, as I mentioned, we can measure sleep, stress, as heart rate variability, and activity. And it's affordable. This is the most important thing to this group. They need something they can afford on a monthly basis. It will be $10 per month by a subscription model, which is 1/10 of the price of over-the-counter glucose monitors today. So today we finished the proof of concept work I showed you with some angel funding. Right now we're raising a Series Seed. We're a little over halfway through that to build our functional prototypes and do a nationwide study in 300 people with prediabetes or non-insulin treated type 2 diabetes. This will, again, allow us to train our algorithm for peak accuracy and proceed on to get FDA clearance in mid-2027. This is the team that's making it happen. Dr. Casey Halpern is our CEO and founder, also a neurosurgeon, as I mentioned. Hansu Lee is our chief scientist, and we have a group of other great advisors. Love to connect. If you go to our website, you can also track our progress and sign up for future studies or information. Thank you.
All right. Questions? Come on down. You don't have to raise your hand. Come on down. Ask away.
Hi, Leo.
Oh, that was great, so novel and innovative, amazing. How is the FDA looking at this since it's so new?
Yeah, that's a great question. So there's a company called BioLink that just did a de novo. And what they're doing, they created a new category called glucose range monitoring that we fit into nicely. So we can use them as a predicate for a 510K path,
nice.
because before that we thought maybe de novo for us. But it's a nice path for us, so it'll be a 510K.
That's really nice. Thank you.
Thanks.
Do you need internet for this to work?
Internet. No, you just need Bluetooth on your phone. So it will talk like a continuous glucose monitor. It just uses Bluetooth to your phone. So, as long as you have Bluetooth connection with a smartphone, you can get the information from the sensor. It will go up to a cloud system for providers to use, but you don't have to be connected all day for that to happen. It can be set when you have it.
So if you're in a rural area and you don't have internet, you don't have cell phone service, would this still work?
As long as you have something with Bluetooth that it can talk to.
Okay.
Yeah.
Thanks.
Yep.
Hi, great one. I'm assuming you can give notifications on a periodic basis, real-time basis, and the forecast. Do you have options for patients to settings, right? Rather than, can they control the notifications? How often they get? What kind of forecast?
Yeah, this is a really important question because people don't want to get just generic, go walk now, go do the, they want something that's personalized to them. So we have a way to capture, what they like to do at the beginning when they're onboarded, and then only give them sort of recommendations along those lines and learn from that information. So learn what they're logging and then give them things, that are more personalized. So that's an important piece. Otherwise they won't follow it.
And one more thing. I'm sorry if I missed it. Can you say a few words on the technology itself? How does it work?
Sure. So let me see if I can go back a little bit. Nope, I can't. It is a small sensor worn behind the ear. It has 2 electrodes on the back side. It continuously measures just EEG signals from that area behind the ear. And it can measure from that, obviously brain signal data, but we can derive heart rate and heart rate variability from that. It's usually considered an artifact, but we're removing it and using it to our benefit. Oh, okay. Thank you. Okay, so you can see behind his ear, so that's the sensor there. So there are 2 electrodes on the other side, and it collects the data and sends it to the phone. The machine, there's lots of machine learning algorithms that we've been developing over the past few years to interpret that data into the different things that I showed. So, glucose levels in real time, the glucose forecast during sleep from the sleep data, activity levels, and stress levels.
Fantastic. I already connected you with LinkedIn.
Oh, good. Thank you.
Okay.
Quick question. How long does it need to be worn? Like a CGM, you wear it for like 14 days, continuous days to get it. So how about this?
Yeah, you can. The user can really take it on and off as they want. If you want real-time glucose, like how your food is affecting your body or stress throughout the day, you would want to wear it all day, and it is comfortable to wear all day. Or you could just wear it at night. We think some users will like that, and wake up to see how you slept, and then the recommendations for your day based on how you slept, that glucose forecast. So really it can be used however the user wants. There is a removable adhesive. We'll send lots of adhesive, so you can change that as often as the user would like.
Okay. So one device, how long does it last?
It's rechargeable for 3 years, and so you have to recharge it once a week.
Okay. Thank you.
Yeah.
And I wanted to ask about some of the recommendations that the product gives you on a day-to-day basis. If it's more personalized, instead of like eat better, walk more,
Yeah.
etc. What are some of the variations that the product recommends to patients?
Yeah, so we're just building these sensors now, so we don't have a lot of patient feedback yet. However, we have a dietitian and diabetes educator group that we're working with to give us these recommendations. A lot of it will be derived from the diabetes prevention program recommendations. However, we have even better, kind of more updated recommendations from some of these diabetes educators. It can be anything related to stress. Stress increases your glucose. It can be anything related to sleep as well, and then the regular things like diet and exercise. But we really, as I said, want to collect what the patient likes to do so that we're not offering them recommendations that make no sense for them. So we'll kind of learn their habits and try to keep it along those lines.
Awesome. Great job. Thank you. Great job, all the companies. Actually, can you all come up? Don't leave yet. Come on back. Come on back. Let me get all the companies up here for a quick photo, and then after that, we're gonna break out into 2 groups, and we'll have some follow-on discussions. So I just want to remind everybody, applications are still open. So don't forget to apply, and then we're going to switch over to our open discussion. We'll have the companies come back down. So again, if you have any additional questions or would like to talk to our moderators at each of the sides, please do so in the next minute once we take this cool photo. Heather, where are you? Heather, you can come up. Come on, Heather. Come on.